If you spend time... Hi, I'm Joe Graydon.
I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy, where we bring you the stories behind the health headlines.
This podcast is brought to you by Redix Industries, makers of Utterly Smooth Body Cream. 800-345-7339, on the web at uttercream.com. Outside, be careful. Experts expect ticks to be rampant this summer. Could a tick bite threaten your life? This is the People's Pharmacy with Terry and Joe Graydon.
A surge in mouse populations this year means we should also expect lots of ticks. And that means people are more likely to experience an infection transmitted by a tick bite. Probably the most notorious tick-borne infection is Lyme disease.
We'll talk with two physicians who had enormous difficulty getting their medical colleagues to diagnose their Lyme disease. Why is this increasingly common infection so challenging to diagnose and treat?
Coming up on the People's Pharmacy, what you need to know about Lyme disease.
First, this news.
In the People's Pharmacy Health Headlines. In the U.S., chondroitin sulfate is usually sold as a dietary supplement and taken in conjunction with glucosamine to treat arthritis pain. Most well-controlled trials in this country have shown that the combination is no better than placebo. A new European study demonstrates, however, that pharmaceutical-grade chondroitin sulfate is significantly better than placebo at alleviating the pain of knee osteoarthritis. In the 6-month-long trial, 604 patients were randomly assigned to take either 200 milligrams of celecoxib, 800 milligrams of chondroitin sulfate, or placebo every evening with water. The volunteers kept a diary of their pain levels and how often they needed an additional dose of acetaminophen for pain control. All three groups reported improvement in their knee pain. The investigators found no significant differences between chondroitin sulfate and celecoxib in their effects. Both were significantly better than placebo. A few patients reported stomach aches as a side effect, but no one group had disproportionately more such reports.
How low should blood pressure go? A new analysis published in JAMA Cardiology demonstrates benefits from lower blood pressure than is currently seen as the target. The researchers evaluated data from 42 randomized clinical trials. Patients who managed to get their systolic blood pressure down between 120 and 124 were only one-third as likely to suffer cardiovascular complications as people whose systolic blood pressure was at 160 or higher. In addition, they were only about half as likely to die during the study. Systolic blood pressure measures the force the heart exerts while contracting. It's the higher of the two numbers and is usually the first when blood pressure is expressed as, for instance, 120/80. The scientists concluded that most people are at the lowest risk for heart attacks, strokes, and death when their systolic blood pressure is between 120 and 124.
Is your morning cup of coffee bad for your health? Not really, according to research from the UK, where tea might be more popular than coffee. The scientists did a systematic review of data from 26 observational studies that included more than 2 million participants. People who normally drank 2 cups of coffee a day were about 35% less likely to develop liver cancer. It didn't seem to matter whether the coffee was decaf or high test, suggesting that the apparent protective effect is coming not from the caffeine, but from some other component of coffee.
Alzheimer's disease is the 6th leading cause of death in the United States, and there has been an increase in the proportion of deaths due to this condition. This was an increase of more than 50% between 1999 and 2014. More people with Alzheimer's disease are dying at home. In 1999, the proportion passing away at home was 14%. In 2014, it was 25%. According to the CDC, this increase in age-adjusted death rates and the greater proportion dying at home could place a greater burden on caregivers. The authors recommend providing caregiver interventions such as home health care assistance, respite care, and education about the condition.
Are you spending more on prescription drugs? A report from Quintile's IMS Institute shows that prices for medicines are still rising more rapidly than inflation. Prices are not increasing as rapidly as they have been recently, though. Spending on medications went up by less than 6% in 2016, about half the rate in 2014 and 2015. The total amount spent on prescription drugs in 2016 was $450 billion. The reason for part of the increased cost is that specialty medicines, which are usually very pricey, account for a bigger part of the bill. These include drugs for cancer, hepatitis C, and rare diseases.
Your mother probably told you to eat your vegetables. Now scientists offer one more reason why that's good advice. They analyzed dietary data from more than 3.5 million older Americans. The average age was 65. Fewer than one-third of the participants ate 3 servings or more of vegetables and fruits daily. However, the researchers found that people who ate the most produce had the lowest risk of peripheral artery disease, a condition that causes pain and interferes with a person's ability to function. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. Disease ecologists have warned that this is likely to be a bad year for Lyme disease and other tick-borne infections. In many regions, the mouse population is skyrocketing, and more mice mean more ticks. Lyme is just one of many diseases that can be transmitted through tick bites. Today, we're talking about what you need to know about Lyme disease.
To find out more, we turn to today's guests. Dr. Neil Spector is an associate professor of medicine as well as pharmacology and cancer biology at Duke University Medical Center. He holds the Sandra Coates Chair in Breast Cancer Research. Dr. Spector co-directs the Experimental Therapeutics Program for the Duke Cancer Institute and is a Komen Scholar. His book is Gone in a Heartbeat, A Physician's Search for True Healing.
Dr. Bill Rawls is board certified in obstetrics and gynecology. He's written about Lyme disease, fibromyalgia, and chronic immune system dysfunction. His books include Unlocking Lyme and Suffered Long Enough.
Welcome to the People's Pharmacy, Dr. Neil Spector.
Hi, it's great to be here.
And welcome to you, Dr. Bill Rawls.
Thank you. Pleasure.
Dr. Spector, let's start with you. You had an extraordinary experience and were misdiagnosed for many years. Can you give us an oversight of what happened and where you are today?
Sure. So I was actually in my 30s, at the prime of my game, running marathons, running 10 miles a day, 6 days a week, training on the faculty actually at Harvard's Dana-Farber Cancer Institute. So, premier academic center, had my research lab. And then we moved to South Florida, took a job at the University of Miami, and literally within weeks of moving there began having all these very bizarre symptoms, initially manifest by rapid heart rate. So my heart, normally your heartbeat maybe 70, 72 a minute. On most people, my heart rate would suddenly, for no reason, start racing upwards of 200 beats a minute.
Wow. And I'm assuming as an athlete, as a runner, your heart rate was probably lower than average.
That's right. It was lower. So, and this was up without provocation, right? You go to a scary movie, maybe your heart rate goes up. So this could be sitting down, eating, lying in bed. And the episodes would last 45 seconds to a minute. And then along with that, I had an episode of brain fog. Now, I describe that as if I were taking 50 milligrams of Benadryl every 2 hours.
Ooh, that's terrible.
Yeah, I was like literally walking through a cloud. And I was taking care of patients. I was writing grants. And that just mysteriously came on. And over the span of about 4 to 6 weeks, then resolved without any cause. And I was told, you're stressed. So every time, so this went on for about 4 years. These, primarily the cardiac manifestations, these arrhythmias. And every time I would get to an emergency room, they would have resolved. And they do the usual EKG, draw blood tests. They'd say, there's nothing wrong with you. We think you're just an overworked, overstressed physician writing grants, so on and so forth. You're having an adjustment problem moving from New England to Miami, which it was somewhat of an adjustment issue. But so nothing wrong, and they had me see biofeedback people, which was great, love biofeedback, had me see psychologists. And I kept telling them, this isn't stress. As a resident, I had worked 140 hours a week at Parkland Hospital, in the ICUs. That was real stress. And I had never experienced anything like what I was experiencing. So finally, after 4 years, and the other remarkable thing was, so I went from running literally 60 miles a week to barely being able to walk 60 feet without having to stop, just from complete lack of energy. And that happened, again, over this initial few months after having moved. And that progressively got worse. It literally got to the point where I wasn't sure from day to day whether I'd wake up or not. And again, continually said, all your labs look good. I mean, no one had ever even thought about any tick-borne illnesses. I was in South Florida. That was 120 out of a list of 100. Even though I had lived in New England for 10 years and had jogged through the woods and all sorts of things. And so finally, after 4 years, the mystery really came to an end. So I started having a persistently slow heart rate of about 40 beats a minute. Now, if you're a marathon runner, maybe that's okay, but I hadn't done anything in 4 years. So 40 beats a minute was fixed at 40 beats a minute. And then I developed, for the first time, arthritis. Not just pain in the joint, but swollen red joints out of nowhere. And could barely lift my arms, could barely hold utensils. And for reasons that were independent of the arthritis, I was given doxycycline. And within 24 hours of taking doxycycline, the arthritis resolved 100%.
Now, we should explain to our listeners that doxycycline is the antibiotic that's usually used to treat Lyme disease if you realize shortly after the tick bite that there's a problem.
That's correct. That's one of the first line antibiotics people use. And so, the light bulb goes on. I said, this is Lyme disease. Got tested. They were going to put a permanent, and by the way, so then they figured out the 40 beats was what's called third-degree heart block, complete heart block. Now, block not meaning that my vessels were blocked, but the wiring system in my heart was shot. And so they were going to put a permanent pacemaker in and a defibrillator, because all the rapid episodes of heart rate that I'd had turned out to be something called ventricular tachycardia, which is a life-threatening arrhythmia that literally could have killed me any number of 1,000 times over the preceding 4 years. So I said, no, this sounds like Lyme disease to me. So they had me tested, and about 96 hours after I ordered the test through my doctors, I got a call from the cardiologist, said, bad news, Neil, the test is negative. Now, at the time, I didn't know negative doesn't necessarily mean negative, and there's controversy around the testing, which we could perhaps get into. So they put a pacemaker in a defibrillator and said, you're going to be fine. This is idiopathic conduction defect in your heart, blah, blah, blah. We don't know what's going on. Just continue your life. And you'll feel better. Well, I didn't feel better. I continued to feel, fatigued, lousy. I forced my doctors to repeat the testing several times. And finally, the test came back positive by the Western blot. And I was treated.
Positive for
Lyme disease. And I was treated for some of the other so-called co-infections as well, which were negative. Although one, they didn't have a test for at the time, which is called Bartonella, and that's another story. So anyway, so they treated me very aggressively. I had a PICC line put in, an indwelling intravenous line. I got intravenous antibiotics. First dose I had what's called a Herxheimer reaction, which is classic for spirochetal infections, where you kill off the bacteria release poisons into your body, and it could be an incredibly severe reaction with, shaking, fever, high heart rate, the whole bit. And so I took that for 3 months, and I had high doses of an oral antibiotic for the last month. And actually all of my symptoms resolved with the exception of my cardiac problems. And so I was then told several months later that my heart function, not only was the wiring system shot in the heart, and I would need a permanent pacemaker defibrillator because I was still having the arrhythmias, the ventricular arrhythmias, but my heart function, what they call an ejection fraction, which is a measure of how effectively your heart is pumping, was 10%. Now I make the analogy.
Whoa. 10%.
A 10% ejection fraction.
That's not exactly compatible with life, is
So
it?
that's not a good number to have. The analogy is it's like having a 6-cylinder car and having one cylinder working. So I was told in 1998 that I needed a heart transplant immediately and was referred for transplant. At the time, I was actually still working, still functioning.
How were you functioning on a 10% ejection fraction?
Whatever myocardial, whatever healthy cells in that heart were functioning were keeping me going, and probably years of running and activity had finally paid some dividends and were keeping me alive.
Because when an older person has an ejection fraction of 10%, they're basically in the hospital.
Yes. And with ventricular arrhythmias, they're going minute to minute, whether they live or not. So I lived 12 years with 10% ejection fraction, with a pacemaker defibrillator, getting shocked along the way several times, an experience I wouldn't wish on my worst enemies. And then in 2009, things came crashing down. And within a very short period of time, I went into florid heart failure. Looked like I was about 6 months pregnant with fluid that had built up in my abdomen and legs that were the size of tree trunks, and ended up in the intensive care unit and was told that I had 72 hours to live without a transplant or a biventricular assist device. It was very fortunate that I had AB blood type, universal recipient, and with 36 hours later had a transplant and was out of the hospital. So that's almost 8 years ago. So I came pretty darn close to losing my life, about as close as you can come from the consequences of a disease which many people say is easy to diagnose, easy to cure. For me and many other people, it almost cost me my life.
And I'm assuming that most people don't realize the heart is a target for this disease, that you basically having such poor cardiac function was a direct result of Lyme disease.
Correct. Yeah. I mean, people think of Lyme disease as the rash, some arthritis, a headache, maybe some cognitive, fuzzy thinking. But you're right. They don't think of the heart as a target. Carditis, inflammation of the muscle, heart block, the bacteria affecting and causing fibrosis or, changes in the tracts that transmit the electrical impulse that we all take for granted that keeps our heart rate at what is a normal heart rate for each of us. So, and the statistics they quote may be underrepresented. So, it's 5-10% of people with carditis. It may be more, and it may be dependent upon where you are geographically. So the Europeans may see more of that, depending upon what species and strains. But yes, people need to be aware, and cardiologists need to be educated, that the first presentation of Lyme disease may be like mine, may be cardiac manifestations.
You're listening to Dr. Neil Spector, the Sandra Coates Chair in Breast Cancer Research at Duke University Medical Center. He's an associate professor of medicine and co-directs the Experimental Therapeutics Program for the Duke Cancer Institute. His book is Gone in a Heartbeat, A Physician's Search for True Healing.
After the break, we'll learn about Dr. Bill Rawls' encounter with Lyme disease.
Why is it so challenging to get Lyme disease diagnosed?
We'll get some basic information on Lyme disease.
What myths and misconceptions are there about Lyme disease?
Do patients with chronic Lyme disease need to take matters into their own hands?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
If you like this podcast of The People's Pharmacy and want to continue the conversation, you can join us online at facebook.com/People's Pharmacy to share your thoughts or comments. Welcome back to The People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Red X Industries, makers of utterly smooth creams and lotions that deeply moisturize to make dry skin feel soft and smooth. 800-345-7339. Online at uttercream.com.
If you would like to purchase a CD of this show, you can call 800-732-2334. Today's show is 1081. That number again, 800-732-2334. Online at peoplespharmacy.com. You can also download the podcast from iTunes.
Today, we're talking about what you need to know about Lyme disease. Both our guests are physicians, and both have their own personal stories of Lyme disease. You've just heard from Dr. Neil Spector about his own encounter with the condition that nearly killed him. That's why his book about it is titled Gone in a Heartbeat, A Physician's Search for True Healing. Dr. Spector is an associate professor of medicine as well as pharmacology and cancer biology at Duke University Medical Center. He holds the Sandra Coates Chair in Breast Cancer Research and co-directs the Experimental Therapeutics Program for the Duke Cancer Institute.
We turn now to Dr. Bill Rawls. He's board certified in obstetrics and gynecology and has written about Lyme disease, fibromyalgia, and chronic immune system dysfunction. His books include Unlocking Lyme and Suffered Long Enough.
Dr. Rawls, we've just heard from Dr. Spector about his experience with Lyme disease. You, too, have had an experience with Lyme disease. I wonder if you'd share it with us.
Yeah, my story is very similar to Neil's, but my circumstances were very different. I decided, finishing medical school, that I was going to practice obstetrics and gynecology, and I wanted to go to a small town on the coast of North Carolina, which I did. I finished my residency at Wake Forest and went to practice in Morehead City, which is a fairly small town adjacent to the Outer Banks. For 15 years, did well, but it's a very demanding profession with call every second to third night. I am one of those people that if anybody was in labor, I was awake. So I spent 15 years being very sleep deprived. Besides that, trying to balance life and being a good father and community person, everything else was highly stressful. So in my mid to late 40s, I started developing many of the same symptoms that Neil expressed, including the arthritis, the brain fog, just feeling like you have flu every single day, but also the cardiac manifestations. I did not have the kind of heart block that he did, but I had almost continual chest pain and PVCs, which are the skipped beats, to the point that it was almost every second to third beat. It was very disconcerting. And I can remember a day that it was a gorgeous, beautiful, warm, early fall day that I was trying to surf, and it was small waves, and I surfed a couple of waves, and I was so bad that I went and laid on the beach and thought, this is it. I'm done. And when it didn't happen, I gradually collected myself, got back to the car, went and visited my general practitioner who had been seeing all along for these symptoms, but they were treating the symptoms and not the condition, really not understanding what was going on. So the next day, they showed ischemia on the EKG. The next day, I was at the medical center at East Carolina doing a cardiac cath, and the cath was clean. The doctor said, well, you can take a beta blocker. I don't really know what's going on with you, but that's what you can do. I didn't tolerate the beta blocker. I decided I would have to live with it. I assumed at that point I was courting the diagnosis of fibromyalgia like so many people because I didn't know what else. Of course, I'd thought of Lyme disease, did the screening test. It was negative, but it all fit because all the symptoms were Lyme-related, and I spent my whole childhood in the woods. And that's the case with so many Lyme patients that I talk to is they don't remember the tick bite. It's that perfect storm of factors that affect immune function that cause this thing to happen that destroys your life. So after that, I picked myself up, and my partners at that point had asked me to leave the practice because I couldn't carry my load of call. Very frustrating because people even older than I was were able to do that kind of call. So I ended up not having any other resources and not having a diagnosis, started a primary care practice. trying to figure it out. What the heck was going on? Looked at natural therapy, which had always been an interest, embraced herbal therapy, and started changing my lifestyle, cut out the bad cold, the stress, the food, getting better nutrition, etc. And I started getting better. But I can remember one July that I had this chigger bite on my rear end. I'd been working outside, and I found a small tick. And all of the symptoms that I'd been fighting came back in spades. And I slowly developed that classic rash, and then I knew it had been Lyme disease all along. I went and tried antibiotics. The antibiotics made me ill. I just couldn't tolerate them at all. So I decided to look for other solutions. Ultimately, I heavily embraced herbal therapy. It became a passion of looking at what herbs are doing and which herbs could be the right combination. And gradually, I climbed out of the hole. It took about 2 years for the cardiac manifestations to go away, but I got my life back.
These are extraordinary stories because in both cases, you're physicians, you're highly trained, very knowledgeable, good advocates for yourselves, and yet in both cases misdiagnosed. I suspect there are thousands, perhaps tens of thousands, perhaps hundreds of thousands of people who have been bitten by a tick, maybe some other insect as well, and after a period of time begin to experience strange symptoms. It may be the fatigue, it may be the cardiac effects, and not get a diagnosis. So help us understand what's been going on for the last couple of decades and why this has been such a challenge. Dr. Spector?
Yeah, those are great points. So it's complicated. I think one of the problems is that we don't have, there aren't good diagnostic tests. Now, some people would argue that we have perfect tests. I've been in research for 25 plus years. I've been involved in cancer research. I've seen the proliferation of precision medicine, the genomic technologies that have come out. I make the analogy, we're using the response of the person to that bacteria. Now, not everyone responds the same. As Bill said, he was stressed and his immune system was probably knocked down. So not everyone mounts that same response. We also know, and this has changed with knowledge, that there's not just one strain of bacteria or one species. There's multiple bacteria, and not all the diagnostics work against the same. And moreover, we know that there are other infections that people may have that may mimic Lyme disease that are not being diagnosed.
Well, let's start with the idea of what is Lyme disease and what you mentioned one bacteria. What bacteria is it and what other bacteria might potentially be involved? Dr. Rawls?
Classically, Lyme disease is considered an infection with a bacteria called Borrelia burgdorferi, if you look at the very classic. But we know now that there are many species of Borrelia that can cause Lyme disease. Supposedly, some are more prevalent in Europe than here and vice versa. But I think the lines are starting to break down that there may be many more species of Borrelia than we know of. And that makes sense because you're talking about a microbe that's been infecting things through ticks for millions of years. They have found Borrelia in ticks frozen in amber that are 15 million years old. So you can figure that ticks are really nature's perfect vehicle for transmitting microbes. So when you talk about a tick bite, you're not talking about whether it carries Lyme disease or not. You're talking about which microbes is it carrying, because it carries lots of microbes, hundreds of microbes, every tick. And I think that's really an important point to make, is that it's not just one microbe, it's many microbes.
So why is it so hard to diagnose, Dr. Spector?
So they're hard to diagnose because these organisms very rapidly get into the body and into areas of privilege. They get into areas that we call, hypoxic areas. Not a lot of oxygen, not a lot of blood flow. They like that environment, very analogous to some tumor cells. And so it's difficult to pick up and culture the bacteria because there often aren't many floating around the bloodstream. They're in the collagen in your heart, in your brain. So we've managed to develop technologies, and I think that the emerging new tests are going to be ones that, so now there's a urine test that can actually identify protein from the bacteria in the urine, which may hopefully soon be FDA approved and replace the existing tests. But I think that these are difficult, organisms to find because they're not hanging out in the bloodstream like a staph infection.
Dr. Ross, you've written about the myths and misconceptions that so many of us have about Lyme disease. Would you enlighten us on some of the leading myths? What do we think is true that really isn't?
Well, I think this conception that Lyme disease is an infection with a microbe and you're sick because of a microbe, and if you eradicate that microbe, you will get well. When I look at it, it's more a function of this tug of war, this chronic immune dysfunction that's going on, not with just this microbe, but I think of it as a pot boiling over. It's like we all are bitten by ticks, bitten by fleas, we go through a lifetime and we pick up these things. And our body, our immune system, our healthy immune system does a pretty good job of keeping them marginalized. But if you get the wrong combination of microbes at one time, or you're taking OB call, or you have these other events going on in your life that disrupts immune function, then you end up with basically a pot boiling over of these things. And it sets up this chronic condition that makes you miserable. So when you look at these microbes, you have to ask the question, well, what do they want? And that gets back to this idea that they're really very low concentrations. Basically, what Borrelia wants and what most of these microbes want is to use your resource as a host long enough to have an opportunity to spread to another host. So that doesn't require high concentrations. It can exist in your body without causing symptoms. And I think what better testing is going to be as we get really good at diagnosing the whole microbiome or our entire makeup of our microbe is that we're going to find we all have these things, and that there are a lot of people that do carry Borrelia that aren't sick. So it's that perfect storm of things that come together that set up this condition that make it miserable.
Dr. Spector, why is it that so many people with chronic Lyme disease seem to have to take matters into their own hands? That, they feel so frustrated that modern medicine has kind of let them down.
Yeah, I think they have to take matters in their hands because we're if you take a step back, we're in an era of medicine, precision medicine. It all sounds nice, personalized medicine. But what that actually means, I think, and I teach young physicians in training in oncology, but this is across the board, is that we're becoming so dependent on tests that we're losing that art of medicine, those skills that, that the giants that walk the halls could stand at the door of a room and tell me that patient has this diagnosis based on observation. We're losing that. And so when you have physicians who now say the diagnosis of Lyme disease is based on 3 bands here, 4 bands there, a positive antibody test. And as again, some of those physicians don't even understand the pros and cons of those tests, the limitations of those tests, and the fact that in the chronic setting, when people have been misdiagnosed for several years and finally come to testing, that's not the same as having a bullseye rash day one and getting tested, that the immune response and the ability to evade the immune system has changed over time. So I think that physicians often look at people like me. I was told I had anxiety when in fact I had raging heart involvement that probably should have killed me at any given moment, and say, you're anxious. Your tests look normal to me. There's nothing wrong. And the standard tests are generally, they look normal. You get your blood counts. They're generally normal. You get your chemistries, your kidney function, your liver. They're normal. So somebody looks at you and says, I don't think there's anything wrong with you. And these are vague, a lot of these are vague symptoms. I can't think clearly. We can't quantitate that.
Dr. Spector, I wonder if you could help us understand how people who find themselves in a situation where they are suffering a lot of symptoms, their doctors don't know what to do with, don't know how to help them, how can they take control for themselves? What should they be doing?
Well, they probably should read Bill's book, for one. I think they need, so the first thing is, if people call me, they say, where can I find a doctor who understands this? I think the first thing they could do is go to, there's an organization called ILADS, which is...
Spell that, please.
ILADS, International Lyme and Associated Disease Society. They'll list, and you put in, very easily, you put in your zip code, and they'll tell you, who in the area is trained. Now, you still have to do your homework. That doesn't mean that somebody... who necessarily you may want to see or not, but that's a starting point. So you really have two decision points. You're sick. If you want to see a physician, you could go see an infectious disease doctor. You may run into some issues because, as we've talked about, the Infectious Disease Society does not necessarily recognize chronic symptoms as being, there's an entity, it's called post-treatment syndrome, but they will not treat you with antibiotics. And again, I'm not saying whether antibiotics are good or bad, although there are a lot of people who have benefited from antibiotic therapy, and the studies that have been done that have disproven that antibiotics work are really not good if you look at them scientifically. So again, I think you could seek out somebody who is at least trained in dealing with this disease. There are other avenues that I've recommended to people. There are organizations that help patients. So there's a National Patient Advocate Foundation that is designed not just for Lyme disease, but for all sorts of people to help advocate for themselves. Because these, in general, these treatments are not covered by insurance. And I would warn people that, it's buyer beware, because this is cash up front. And many people go through their life savings and mortgage their homes to get treatments which don't necessarily help them. So, you've got to be very careful. You have to be your best consumer. You have to look and see what type of therapy and what people you believe have, good understanding of this disease. But I think the good place to start is ILADS.
You're listening to Dr. Neil Spector of Duke University Medical Center. His book is Gone in a Heartbeat, A Physician's Search for True Healing.
We've also been talking with Dr. Bill Rawls. His books include Unlocking Lyme and Suffered Long Enough. After the break, we'll find out why Lyme is called the Great Masquerader.
We'll also find out about a multimodal approach to treating Lyme disease. You're listening to The People's Pharmacy with Joe and Terry Graydon. If you value the health information you get when you listen to The People's Pharmacy, consider subscribing to our email newsletter. You'll get the latest health news and information on upcoming podcasts delivered to your inbox twice a week. Look for the link at peoplespharmacy.com.
Welcome back to The People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Red X Industries, makers of Utterly Smooth Foot Cream with shea butter, helping dry, cracked feet feel utterly soft and smooth. 800-345-7339. The website is uttercream.com.
To purchase a CD of today's show or any People's Pharmacy broadcast, you can call 800-732-2334. Today's show is 1081, or you can place your order at peoplespharmacy.com. You can also download the free podcast from iTunes.
Today, our topic is Lyme disease and its complications. We're talking with two physicians who have personal experience with Lyme. Dr. Neil Spector holds the Sandra Coates Chair in Breast Cancer Research at Duke University Medical Center. He's an associate professor of medicine and co-directs the Experimental Therapeutics program for the Duke Cancer Institute. His book is Gone in a Heartbeat, A Physician's Search for True Healing. Dr. Bill Rawls is an OB/GYN who has written about Lyme disease, fibromyalgia, and chronic immune system dysfunction. His books include Unlocking Lyme and Suffered Long Enough.
I wonder if you could give us some sense of what are the symptoms that we're referring to when we talk about Lyme disease or some of these other conditions.
The range of symptoms is broad, and you're talking about total body dysfunction. So when these microbes, what they're doing is manipulating the immune system. They affect chemical messengers called cytokines that are produced by white blood cells, and the whole purpose is to generate inflammation. So it's not generating inflammation in a spot like a pneumonia. It's not an aggressive and localized infection. It's a disseminated infection throughout the body so that the symptoms are quite broad. Anywhere that there's inflammation, and that can affect hormonal balance in the body. It can affect central hormone pathways, what we call our hypothalamic pituitary adrenal axis, which is what manages all of the functions in the body. All of that becomes a disrupted equilibrium. So it's a huge range of symptoms, anywhere from localized symptoms like arthritis all the way to brain fog and just feeling flu-like and miserable.
Yeah, I think the classic, and I think this is a warning to people, usually they see the nice target lesion like you see on the Target store.
The bullseye.
The bullseye. And so that's what physicians are taught, and I think that's what a lot of the population, look for the bullseye rash. Now, the bullseye rash, depending upon who you believe, may only occur in a minority of people, and certainly is not, 90% of people, may not look like the target lesion that you think may be in your scalp. And so how do you find it in certain parts of your body? So classically, people are told, look for that target rash, and then generally a flu-like illness at the wrong time of the year, right? So in the summer, fever, lymph node swelling, headache, muscle aching, like you're having the flu, but the flu's not going around that time of the year. The problem now is that ticks are out all over the year, so you can't just say from May to September. So you've got to be aware of this. Then once it sort of spreads beyond that, this is now called the Great Masquerader. There used to be, its relative used to be called the Great Masquerader, syphilis, which is also a spirochete, a form of the bacteria, just like Borrelia. So these two are cousins. And they both invade, as Bill said, you look for the symptoms where these tend to go, the brain fog, cognitive problems, talk to people, memory issues, visual disturbances, neurological, peripheral nerves. I had severe burning in my feet, dysesthesias, very painful types of sensations.
Yeah,
myalgias.
That was a miserable experience.
Yeah, the arrhythmias, GI problems, leaky bowel type syndrome, diarrhea, just not irritable bowel-like type of symptoms.
But a lot of doctors would say, those are general symptoms. I see a lot of patients that come in with all of those symptoms and they don't have Lyme disease.
Well, they don't have Lyme disease based on what criterion? So, again, you've got inadequate testing. It's very interesting. The criteria that have been used are based on very prescribed. You must have so many bands on a Western blot, a test to look at proteins. Now, these were generated by the CDC, the Centers for Disease Control, and a society that's comprised of the infectious disease experts in this country. If you actually go to the CDC website, it says, plain and clear, these criteria were used for epidemiologic studies, right? So if you want to study what the criminal behavior in California is, you might go to San Quentin. It doesn't mean like the only criminals in California live in San Quentin. It's just that you wanted to narrow that population. So if you want to say, I want to study in Chapel Hill, North Carolina, how many people have Lyme disease, then you might, as a population study, want to restrict it to those people who have the very prescribed criteria based on testing. That was never meant to say that if you fall outside that bound, that you don't have it. In fact, the criteria on the website say, or the recommendation is, clinicians use your judgment. And that's the problem we have nowadays.
Well, Speaking of geography, there was a period of time when we were told, well, Lyme disease is just in the Northeast, Connecticut. And then it kind of spread a little bit, and then a little bit more. But we were told for a long time, oh, no, there's no Lyme disease in North Carolina. You couldn't possibly have caught it here.
And people in a lot of other states are told the same thing. And yet, if you look at a map of where the Ixodes tick has gotten to and has been collected, it's almost all over the United States. Not quite. There's a few places where they don't have Ixodes ticks, but...
Yeah, we look at it as a concept of, well, you either have a tick that can give you Lyme disease or not. Every tick spreads microbes. That's what ticks do. So every tick every time anyone is bitten by a tick, there are microbes that cross into your system. Most of the time, though, your immune system is right on top of that. And because there is a familiarity with the immune system with these very, very common microbes, we've been exposed to these things for so long, they're not new to us. And that's the problem, is they've developed these very stealthy characteristics that make them hard to find and very hard to treat. So so whenever you're looking at a tick bite, you're looking at microbes being there.
Dr. Spector, you were talking about the idea of a target, bullseye rash, flu-like symptoms, and that would be the classic diagnosis, Lyme disease, and the classic treatment, as I understand it, would be a course of doxycycline. How good is that?
Well, I think so how good is it? So for a lot of people who get Lyme disease and get treated early on, and early on, originally the number of hours that a tick is on your body and engorged has dramatically shrunk. From 72 hours, get the tick off, you're going to be okay, to 24. Now there's evidence that even less than 24 may be too long. So thankfully, many people, and probably most people, do get better. Now, it's not to say that, there may be lingering symptoms, but most people do not suffer the sorts of consequences that, Bill and I have been talking about. If you look at even some of the early papers from the classic Lyme disease gurus, they report that about 40% of people do not get better. So treatment early is better, right? Prevention is best. Treatment early is better. But unfortunately, there's probably 40+ % who with the recommended antibiotics don't get better. Now, again, whether that's because we look at this as one disease and, you got your Lyme disease treatment, or as Bill mentioned, because you're getting polypathogens in a tick bite, and half of those we don't even know how to diagnose, or we probably don't even know their names yet. That's a potential other cause. So, this whole notion of chronic Lyme disease, I think, may be somewhat of a misnomer.
Dr. Rawls, this idea that if we just catch it early enough, or if we just treat long enough with antibiotics, and that has been quite controversial, how long is long enough, we can knock out the problem, we can cure it. You have a slightly different perspective. Could you share it?
I think there is value in treating after an acute tick bite in someone who develops symptoms per the CDC recommendations. But what I found is, because our immune system is so familiar with this thing, most people don't get sick. Most people don't remember the tick bite, and they generally don't show up. So most of the, as far as our testing, it's designed to diagnose acute infection, but the people being tested have chronic infection. So there is value, but I've seen all too many people that got that 30 days of antibiotics, and 6 months later they're showing up with symptoms of Lyme disease.
So you have described what we're going to call chronic Lyme disease as in part an immune dysfunction. Can you give us a little sense of what's going on with the immune system and how you have gone about treating yourself and other patients with a multimodal approach?
Sure. Chronic Lyme disease is a lay diagnosis. It's not an official diagnosis, but it fits, and that's what a lot of people use. So I've come to use it just because people understand it. And it's people who years, months after whatever they think has been the introduction of the microbe are sick, and they have the symptoms that just don't get better with antibiotics or anything else. So when you look at the antibiotic therapy at that point, these microbes are in such low concentrations, growing so very slowly, that I talk about entering a race. So if you administer the antibiotics, you enter a race. Are you going to achieve your goal of eradicating the microbe before the side effects of the antibiotics, such as disturbing flora, are going to catch up with you? And in Lyme disease, often that's the case. I gravitated toward herbal therapy because herbs work on a very, very different fundamental level, and it fits this particular condition quite well.
Well, I'm sure that a lot of people are fascinated by the idea of an herbal therapy for this difficult-to-treat condition. What are the herbs doing, and which herbs are primary?
When you talk about any herbal therapy, you're talking about plant medicine, and you have to ask that question, well, why is it there? Why do plants have all these chemicals? And plants are having to deal with these same factors. Plants have to deal with every variety of microbes, of every physical stress possible. So they don't have an immune system, and they've solved these problems with biochemical solutions. So when we, as a species, take in those biochemical substances from the plant, we gain similar benefits. Humans have known that all of time. We've been using herbal therapy for thousands upon thousands of years, and we gravitated toward the plants that particularly mesh well with our biochemistry. So we know what plants out there are poisons and what plants have benefit that aren't going to hurt us. So that's information that we don't, it's known. That's well known. We have all the traditions of all the herbal medicine through time. So when you apply that, you're not talking about a single synthetic substance designed to interrupt a specific pathway in the microbe. You're talking about a spectrum of hundreds, possibly thousands of chemicals in each herb that have the effect of suppressing the microbe in many different ways. So you don't have the same kind of possibilities of resistance that you do with standard antibiotic therapy. Would I treat acute pneumonia with herbs? No, it would be negligence. I would never do that. But when you're talking about a slow-growing microbe that's so stealthy in its capabilities, that suppressive properties of the herbs are very valuable. You combine multiple herbs. There's a huge list: cat's claw, andrographis, sarsaparilla. There's so many wonderful herbs. With that together, then you get different plants that have been grown in different environments, so you get slightly different overlap.
In summing up, Dr. Spector, what would you like our listeners to take away from your story, as well as Dr. Rawls' story, in maybe being better educated and interacting with their health professionals so that they don't have to repeat what you have experienced?
I think the message really is that this is complex, that, calling this by one name, that this is a complex disease. There are many pathogens, that people should not look for the warning signs that are, in all the internet. You have to have the rash, you have to do that, because you're going to miss this. I think people need to appreciate the fact, because your doctor will order a test, and you need to understand the controversies around those testing. And sometimes when somebody says your test is negative, the first thing you could say is, what does that really mean? Okay, just because they have an MD, I'll be the first to admit this, many physicians don't even understand the science behind the tests. So you need to be an advocate. So the main message here is you need to be an advocate for yourself. And you need to really look. I think what Bill's saying is really intriguing as far as having herbal supplements to help. Maybe in some situations antibiotics help with herbal. I don't know necessarily that they may be completely different. or that they may not be synergistic and can be used in ways that complement one another for some people. Again, you need to understand that not only do you need to get tested for Lyme disease, but you need to get tested for other pathogens, because many people would say that Lyme disease, that the people who don't get better may have been successfully treated for their Lyme disease, but not for Bartonella or Anaplasma or any of the other ones that you go down the list. And so the message is, for some people, this is easily diagnosed and thankfully easily treatable. But for many people, this is not easily diagnosed. For people like myself who fell through the cracks, who did not see the rash, who had, sort of testing that was in a gray area. And once you're into that chronic phase, you can have real problems.
Dr. Neil Spector, Dr. Bill Rawls, thank you so much for talking with us about Lyme disease today.
Thank you.
Pleasure. Thank you very much.
You've been listening to Dr. Neil Spector, the Sandra Coates Chair in Breast Cancer Research at Duke University Medical Center. He's an associate professor of medicine as well as pharmacology and cancer biology. He co-directs the Experimental Therapeutics Program for the Duke Cancer Institute and is a Komen Scholar. His book is Gone in a Heartbeat, A Physician's Search for True Healing.
You also heard from Dr. Bill Rawls, a board-certified OBGYN who has written about Lyme disease, fibromyalgia, and chronic immune system dysfunction. His books include Unlocking Lyme and Suffered Long Enough. You can find them on his website, RawlsMD, that's RAWLSMD.com. We have a link to it from our website.
Lynn Siegel produced today's show. Al Wodarski and Russ Henry did the engineering. Dave Graydon edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
The People's Pharmacy is made possible by Redix Industries, makers of Utterly Smooth Extra Care 20 Cream with 20% urea for extra skin protection. 800-345-7339, online at uttercream.com.
To buy a CD of today's show or any other People's Pharmacy broadcast, you can call 800-732-2334. Today's show is number 1081. The number 800-732-2334, or look for it on our website, peoplespharmacy.com.
When you visit our site, you can check out information on prescription drugs, herbal medicines, and home remedies. Share your thoughts on today's show. We'd love to have your feedback.
At the website, you can also sign up for our free online newsletter or the free podcast of the show. You can listen at your own convenience or share it with a friend. We'd certainly appreciate you rating our podcast at iTunes, Google Play, or wherever you subscribe.
In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening. Please join us again next week.
We hope you enjoyed this podcast. If so, please consider taking a minute to write a review on iTunes. And thanks for listening to The People's Pharmacy.
When it comes to Father's Day, some things never change. Dads want steak. And the experts at Omaha Steaks are making it easy for you to deliver uncompromising quality with gifts that are sure to make his day. Plus, get an extra $35 off with code THANKSDAD when you shop omahasteaks.com today. We know, being your dad means he already has everything he could want. But just picture the look on his face when he sees those extra-aged USDA-certified tender steaks, juicy air-chilled chicken, beefy burgers, and more. With carefully curated gift packages from America's original butcher, it's never been easier to show everyone why you're dad's favorite. And every bite is 100% guaranteed to bring a thrill to the king of the grill. Shop now at omahasteaks.com and get an extra $35 off with code THANKSDAD. But don't wait. Father's Day is June 15th. Minimum purchase may apply. See site for details.